Welcome to the Christie Taylor Show. I'm your host, Christie Taylor. And in this month of Black History, we are going to be talking to someone who has made Black history now. And I'm super excited to talk to her because she's making things happen in the medical field. And that's none other than my guest, Dr. Dorsha James MD. Now, she is an emergency physician, plus she is the founder of myURGENCYMD. A native of Pontiac, Michigan, Dr. Dorsha obtained her undergraduate degree in biology from the University of Memphis, right here, yes, hometown, and graduated magna cum laude from James H. Quillen College of Medicine at East Tennessee State University. Now, for over 15 years, Dr. Dorsha James MD worked as an attending emergency physician in the Nashville Metropolitan area with supervisory positions as the emergency department assistant medical doctor, director, and medical director. Now, Dr. Dorsha noticed the excessive use of emergency rooms for non-emergency conditions by those without insurance or a primary care physician. So she made things happen, you all. In 2018, Dr. Dorsha founded the telemedicine company, myURGENCYMD, to provide an affordable alternative to this ever-growing problem. Now, myURGENCYMD offers its members virtual medical consulting by video chat with 24/7 access to licensed physicians and master level mental health therapists and other time and cost saving benefits such as patient advocacy. I want you all to help me welcome my guest, Dr. James. Good morning,
Hello.
good evening, all of the above.
Hello. Good morning, good evening, all of the above.
I'm super excited to have you because in Black history, we're oftentimes talking about those who have paved the trail for us and paved the way for us as far as when it comes to excellence. But I wanted to pause at the beginning of this interview to say, I salute you for making Black history now.
Well,
An
thank
African
you.
American has started her own telemedicine company. We're going to get into all of that. But before we do that, Dr. James, you have some roots in Michigan and Memphis. Let's talk about that.
Yes, I do. So I was, like you said before, I was born and raised in Pontiac. And then my senior year, my mother decided that she wanted to relocate to the South to be closer to family. I kind of had the decision whether or not to stay or go. I had a scholarship in Michigan. I had everything planned out as far as my career, for what a 17-year-old can plan out. And so I made the decision to move to Tennessee. We moved directly to Columbia, Tennessee, which I'm not sure if you know much about that, but I always call it from Motown to Muletown because they have Mule Day there. And so I went to college in Memphis. And so that's where I forged, the rest of my life. That's where I set my goals to become a physician. That's where I met all of my friends. That's where I pledged. And so Memphis has a very big chunk of my heart because I spent a lot of time there. I'm there every other month. So yes, I have some deep roots in Memphis. I have family there. My best friends live there as well.
Well, we are so excited to have you on the show, repping Memphis as a surrogate in the eastern part or central part of Tennessee. So from Memphis, you went to Nashville, as many people do when it comes to getting that upper education in the medical field. Let's talk about your transition to Nashville.
Yeah, so after I left Memphis, I came back to Nashville for a year. I actually wanted to take a year off before I went to medical school because I knew from that point forward my life would be changed. So I went to school in East Tennessee. So I have 4 years of living in East Tennessee, and then I came back to Nashville. My wife always tells me to toot my own horn sometimes. So I was the first African American female in the Department of Emergency Medicine at Vanderbilt University. So I came back here, went to Vanderbilt, and then I ended up, kind of putting my roots in the ground here. I tell people that I know more about Tennessee than most Tennesseans because I lived in West Tennessee, I lived in Middle Tennessee, and I lived in East Tennessee. So being here in Nashville, I absolutely love it here. Um, the growth is amazing. Since I've been back, I mean, it's a completely different city. But making the adjustment kind of to a big city life coming from Johnson City, Tennessee, I actually had to make that adjustment again. I couldn't leave my car running at the gas station anymore when I went in. So it's been really nice. And then being able to train at one of the top facilities in the country was actually a blessing because, I was able to take those skills and actually work in rural areas and be the only doctor within a few hundred miles sometimes. So yeah, it's been a journey.
Now, when it comes to being, for those of us who are only, connected to the medical community because we get a call for a flu or something like that, really, let's talk about your focus as an emergency physician and the various, as you say, your wife says, toot your own horn, the level of expertise that you have enjoyed.
So as far as emergency medicine, it's one of those, I tell people that I know a little bit about a lot. So it's one of those kind of jobs where you have to know exactly what's going on, exactly. And sometimes you don't know exactly because anything walks in off the streets. It's one of those kind of jobs where you have to know a little bit of a lot of things. I can't say that I've seen everything, but people always ask me, what is the craziest thing you've ever seen in the emergency department? And it's really hard to answer that question because some things that I don't think are crazy, some people would think was just out of this world. I've seen, I would say 90% of the craziest things that anyone can see. So it's one of those professions that I absolutely love my profession. I can say that, people would look at it and they think that it's like ER on TV.
I was about to say that. Only thing I have is Grey's Anatomy TV shows.
I mean, literally, it is not. If people could see the amount of paperwork that we have to do, the amount of just non-emergencies that you have, and that's kind of a segue to emergency MD, but just non-emergencies, and not because that people shouldn't be there, but because people don't have an option to be anywhere else. And so that was kind of how my career intersected with the telemedicine world, because I saw a lot of people coming into the emergency department with no other options. African Americans, we use the ER at higher rates than other races, and so we haven't quite figured out why. But we do. We're there more than our white counterparts, and so me seeing that made me want to see if I could figure out a solution. It's a hefty, lofty goal, but to kind of figure out a solution, and if I can just do my little itty bitty part, I would be satisfied, and I would feel like my goal and aspirations have been reached.
Now, Dr. Dorsha, I like that, Dr. Dorsha James, when you are talking about, first of all, the television version of the emergency room, isn't the everyday. And in addition to being a practicing physician in that space, you also had opportunities to move into supervisory positions. Let's talk about that particular aspect and how that led even more so to you standing up your own company.
Yeah, so I became the first assistant medical director. And so basically what an assistant medical director of the emergency department is just there to, you're on committees, you try to help change the trajectory of the department, and you assist the medical director. And so I remember when I decided to leave one position, which was here in Nashville, and to go work in rural areas. I wanted to be a travel doctor. And so I'm like, I can make more money and I can go be the only doctor on staff and I can do all this cool stuff out of rural areas. And so I started traveling and I went to my very first location, and I never really thought about going any higher up into a supervisory position. I just wanted to kind of do my thing and not have any other expectations outside of my shift. And so I get there and I formed this bond with the CEO of the hospital. And I had a company approach me and say, okay, not only do we want you to stay here, but we want to make you the emergency department director. And so as far as the supervisory role, I had to now be over physicians. And I was the boss of the doctors. And I mean, it was like herding cats sometimes. I didn't really know that we were that difficult to work with. But in seeing, you know, how people interacted with the physicians, how people came to the emergency department, I was able to kind of step back and take a look at the entire department and how everything worked together. And that even more so had, you know, made me think, man, some of these people coming from these distant, far places, driving an hour to get here because their child has an ear infection, when they could have stayed at home and just visited the pharmacy in the morning, you know? And so, so that was another thing, like I said, for me to step back, being in a rural area, being in a supervisory role, reviewing charts and things like that. Like, wow, these, you know, these folks could have had their problem solved without coming to the emergency department, getting a big bill. So I think that it didn't necessarily spark the flame because the flame was already sparked, but it just kind of helped fan the flame, being in a supervisory role.
Well, you know, when it comes to, you know, how God guides us, you went for one thing, and yet in that position, well, in that environment, you were elevated and gave, you know, were giving an opportunity to explore other ways of approaching medicine. Now, for those of us who wants to get a layman, explain to us telemedicine and how you made it.
Okay, luckily, you know, it's an easy concept, which I'm so happy about. But telemedicine is the ability to see a doctor, to see a specialist, to see a nurse, but to see any person via FaceTime or video, audio, telephone, or even email. The American Medical Association says that 70% of primary care physician visits can be handled by phone, video, or email. A lot of people do not know that, except we found that out last year. So it's the ability to talk to a doctor. You schedule an appointment. You can get a doctor to call you back right then, or you may say, hey, I'm not available until tomorrow on my lunch break. Can a doctor call me tomorrow at noon? And so what some people are a little bit leery. Like I said, last year changed the game completely. But a lot of people are a little leery, thinking that doctors can't really treat them over the phone. I always give the example. So there are times that the ER is like the TV show. There are times. Those are very, very fun times for us as ER doctors. We absolutely love when there's, you know, a trauma here and a heart attack here and a stroke here. Like, that's fun. And I don't mean that to make light of anybody's condition, but that's what we train for. We train to take care of a lot of things at one time. So in doing so, and, you know, in the middle of a busy 10-hour shift, there's 20 people in the waiting room, all the rooms are full, the hallway beds are full, and they're still bringing people in. Sometimes we don't even have the opportunity to use the bathroom. So I have went 14 hours and not used the bathroom, partly because I was dehydrated, because I didn't have time to even take a sip of something to drink. So I tell people that as we're sitting there, as I'm sitting there and I'm taking that bite of a sandwich, because I get 2 minutes to take a bite of a sandwich, I need to be able, with my eyeballs, as a person is rolling past on a wheelchair, on a stretcher, or walking past, I need to be able to see if that person needs me to get up and come in the room at that moment. And so what a lot of people forget is that we were trained to see things. That's our exam. Hear things. That helps us put things together. And then finally touch on a person. Most things we don't have to touch on people for. And a lot of folks don't even realize that. I mean, people come in and, you know, they have an ankle sprain. I would still put my stethoscope on their chest, just because I know that most people think like, oh, well, I haven't been to the doctor if I haven't been touched, you know?
Right, exactly. I'm thinking that, like, that, we said bad bedside manners was like
bad bedside manner.
Yeah, we're thinking they didn't talk to me. They didn't say anything. They
Right.
just walked,
They didn't touch me. They just walked in and walked out. And
right.
9 times out of 10, we've looked at your triage, we've looked at what your complaints are, we've looked at your vitals, and we know before we walk in the room what it is. We ask a few more questions just to make sure. That tells us what lab tests we need to order or if we need to order anything at all. And then we tell you what we think it is. And so a lot of the times you don't need to touch somebody to do that.
Wow. We
Yeah.
have been spending too much money at the doctor's office.
Right. And so, people don't realize that telemedicine's been around since the 50s. And I'll quantify that. So the very first telemedicine kind of telehealth consultation was between two radiologists, and they were able to send an X-ray over the phone from one part of Pennsylvania to the other part of Pennsylvania. We've been using it because doctors talk to doctors over video. So we have videos, the screens that if we think somebody's having a stroke and we don't have a neurologist there, we can wheel it in there. The neurologist can look at the patient and tell them to do certain things and tell us what kind of stroke they're having and what we need to do. So we've been using it for a while, but now 96% of people own cell phones. So that means that 96% of people, at least a certain group of people, have the ability to have they're like the Jetsons, to have a video monitor in the palm of their hand. And so that's how telemedicine came to the masses.
Wow.
And then COVID strikes.
Yes. So what was the impact of COVID on the medical community and, as you say, on telemedicine?
So I remember, we started this company in 2018, and I had to literally go to someone, explain to them what telemedicine was, explain to them the benefits of telemedicine, and then try to get them to purchase or enroll their business into the program. Very, very difficult to do that when you have a product, is to introduce them to the concept of it and then get them to buy it. And I'm no salesperson, but that's a very difficult concept. At least it was for me. So, but if they gave me long enough, I could usually sway them over. But in last year, all of a sudden, telemedicine was pushed to the forefront. I mean, in front of everything, because people needed to see their doctors. People needed their prescriptions refilled, but couldn't go in to sit in a doctor's office. And then people were being educated on what it was because they were actually thrown into it. And then secondly, the government started paying and reimbursing better for telehealth visits. And so that made it, for doctors, that was an incentive to do telehealth visits because now they were getting paid for them. They could sit at their desk and they could just, go through their patients. For companies like me, we don't accept insurance. We don't have to worry about any of that. It's such a small nominal fee per month that you don't have to have insurance to have us. You can have insurance to have us. And it's the same price either way. And it's cheaper usually than how much people with insurance pay for it. So go ahead.
Dr. I do understand, like you said, with what happened in COVID, that's 2020, but you actually started in 2018. I just wanted to backtrack for a second.
Mm-hmm.
You're starting in Nashville. I understand that part of your concern was those who were attending college, HBCUs, and of course, Nashville has a plethora of colleges and universities. And so with that being your primary target, also self-employed people like myself, let's talk about that particular part and the affordability of it and the accessibility.
Yeah, sure. So you're right. I figured, me and my wife talked about it. She helped me found the company. She's an attorney, so I have an in-house attorney, which is good. But we were sitting and we were thinking, and because there's other telemedicine companies out there, just who could we focus? Who would be our focus? Who are the people that are looked over? when it comes to telemedicine and providing this affordable service. And so the first thing we thought about small business owners, people who are self-employed, the barbers, the cosmetologists, the bartenders. We thought about nonprofits because, you know, a lot of them can't afford to give their workers insurance. My sister has a nonprofit, so I knew the behind the scenes of a nonprofit, knowing that they're working without any type of insurance at all. And then finally, HBCUs, because HBCUs always get the last of everything. And so we decided, since we were an African American company, that we would go to HBCUs and say, hey, you know, we have this service. Now, that was a difficult sell before COVID. It was a difficult sell because, you know, well, we have student health clinic, they can go there. There wasn't a lot of remote learning per se. And so after COVID hit, there were funds available, and it was more of a need because students were doing remote learning, and they still need to be seen by a doctor. I mean, you know, even if they're in Ohio, you know, they need to be seen by a doctor. So, so that's why we targeted them. And then, like you said, just the affordability. Our plan is only $24.95 a month, and that includes a whole family of seven, for the same price, not $24.95 per person, but $24.95 total. And it comes with 4 different services that you can use. So that to me was like, that's what made my heart warm, not to sound mushy or anything, but the fact that I could offer something by partnering with all of these different services. I could offer something at a rate that people actually could afford. I mean, and there's no fees to use it every month. Like, you can use it as much as you want to, and there's not like a copay or anything. And so, yes.
Now,
So go ahead.
you speak about the 4 different services. Now, what are those, and how can somebody get involved? I mean, I have your website scrolling across the bottom. Is that the main entry point? But what are the services first?
Yeah, the services that we have the telemedicine, and I've already went into that in detail, where you can see a doctor over your phone, computer, laptop, tablet. We have behavioral health, where we have master level therapists with at least about 15 years of experience that you can talk to the same therapist for all of the issues that we're having. You know, African Americans are the least likely to get help because most of us feel like that's a sign of a personal weakness. We also have patient advocacy services, which are advocates who can help you find insurance if you don't have insurance. If you do have insurance, help you navigate so you can kind of figure out what your insurance plan is actually all about, help you explain some things, help you make appointments, help you get second opinions, anything that you can think about that's related to the medical field. Our patient advocates can help you with that as well. And that's all included with the service. And then the last service is you can email a specialist. So you can message a specialist 24/7. And we have 9 different specialists that you can email, things like dentists and psychologists and pediatricians. Like, if you just, instead of doing Dr. Google, like, hey, Google, what is this rash? And then Google is like, your arm about to fall off. You could actually send a picture, send an x-ray, send a lab. If you don't understand it, and a doctor will read it and tell you about it. I know my wife had to use the dietitian. She's diabetic, and she was having some trouble kind of managing getting her blood sugars tight again. And so she wrote the dietitian, and this lady wrote her back about 4 pages of information to help her with telling her the carb counting, and I mean, literally everything. So and I've had to use it because I had a question about a medication. So I emailed a pharmacist, and they were able to get back with me. So, I mean, it sounds too good to be true. It really does sound too good to be true.
How did you make it affordable? And also, how important was it for you? Okay, I'm about to sound really, Black history. Is it really a big deal that you opened your own telemedicine? What is the likelihood of an African American woman owning her own telemedicine company?
I've been looking, and to see. Now, there have been, during COVID, there were 3 sisters in, I think, California who started telemedicine, but just for their clinic. I haven't seen too many of me's out there, and I've actually looked. So I'm not saying I'm the first, but I'm probably one of few. The way that it was done is that we took a collaboration of different services and we put it together. And I use the example of AAA. So we all pay into AAA every month.
Yes.
We all don't use AAA every month though. But when we use it, we may have $1,000 bill that we would have paid had we not had AAA. So that's kind of the concept of this. It's, we're all paying in for this service. When I need it, I need it. But it's so affordable that if I'm not using it, I don't feel bad having it. If that makes any sense. So
it's like everything else. It's like health insurance or car insurance, life insurance.
Yeah,
we put it in place as it says, when there's an urgency. And I like the tagline, and not an emergency. I love that. So I do hear that you and your wife, who is an attorney in Nashville, started this in-house counsel. I like that. And I do hear that you are, of course, part of the let me make sure I say right, LGBTQ community.
Yes.
What type of benefit has it been for that community specifically? Because we do know there's a lot of discrimination in the medical field, oftentimes, to those who are in that community. Can you talk about that?
First, I'll say my wife will correct me for calling her a lawyer. She's a judge now, so.
Judge.
Yes, the honorable judge. So she would get on to me. So I have to correct it. No, I'm just kidding. She and I both. We started a company called I Am Just Human, which is kind of a campaign to remove labels. We don't really like labels that much. However, with our service and us being able to offer mental health, that has been one of the biggest impacts, and that's an impact that I'm proud to say that we're having. Yes, people can see a doctor at home over their phone and video and email. That's all fine and good, but at the end of the day, a lot of us African Americans, LGBTQ, a lot of us are hurting. A lot of us have issues that we need to talk out, but we can't afford to talk it out, the stigmata associated with it, or we just don't know where to go. And so that portion, being able to have someone have a consistent person that they can talk to, that is objective, that they can talk to whenever they need to, for me is hopefully a big impact that Rachel and I can leave with the LGBT community. I think that, you can go find telemedicine everywhere, but getting someone the help they need for less than $25 a month when it costs, I've seen therapists. I see therapists now. It's $150 a session. Like, it's no joke. And so, and then some of the things some of the new commercials that we're seeing, they don't tell you the price because it's $280 a month to see somebody. And so, so for me, that is one of the things that I really, really want people to use. Like, I want them to use that up because I think a lot of us, we have issues that we're not taking care of just because we don't, we're concerned about walking into a therapist's office. We don't want somebody to know that we're talking to a therapist. So I really, that's going to be one of the things that we really, really harp on in the next, in the upcoming years, because we need it.
Dr. James, this is nationwide, correct?
It's nationwide. So it's all 50 states. And we even have doctors in Puerto Rico. We have a bilingual experience. So if you want to talk to a doctor in Spanish, you can do that too. Not too many of the telemedicine companies do that, where they have a bilingual experience. But, our Hispanic sisters and brothers, they also need, they're suffering with some of the same things we are. And so they definitely need some of the same services that we need. So I was really proud to be able to say that it's bilingual as well.
One thing I want to say is that the focus that you have, first of all, as you say, when COVID hit last year, it put telemedicine to the front. But I like the fact that you are stressing the mental health part of it. I have a girlfriend who lives in Michigan, and she has definitely been very vocal. Of course, she was the one that turned me on to therapy in our 20s, so she's always been very vocal about it. But she has been really speaking to how she's had to be very, very gentle with herself and find ways to incorporate normalcy, create normalcy. So I'm definitely going to be sharing with her this, because we have still been very committed to if we don't have to go out, we don't. So to be able to have this available, I just want to say thank you. Thank you very much.
Thank you. Thank you so much.
I want to definitely also give people another chance to get a wrap up, but we're going to do that right after this. Welcome back to the Christie Taylor Show. My special guest is Dr. Dorsha James. She has some Memphis roots, but we have to give her up to Nashville. But she has been doing amazing things in the Nashville community, including being able to birth myURGENCYMD, a telemedicine company. She and the honorable judge has created, and it really was right on time. 2018 positioned you perfectly for 2020 and beyond. From a medical perspective, where do you see the future of this going?
Yeah, in 2015, where I was kind of first introduced to the business side of telemedicine, it clicked in my brain that this was the future of medicine. They have started surveying people who have used telemedicine now, and 83% of people that have used it say that they expect to use it on a regular basis. It's the future of medicine. It really is. We're all about convenience. We're all about having our food delivered,
Right now, Zooming.
Yes. We don't want to get dressed. We're in our PJs at the bottom, And so I really do think the convenience and affordability of it all will make it attractive to people to continue to use. Yes, there are things that you definitely shouldn't be seen over the phone for, but the good part about it is we have our doctors. We don't use physician assistants or nurse practitioners. There's nothing wrong with that, but we use all MDs or DOs. And so the good thing about having a doctor on the other end of the phone is that you're getting a great triage. Right. So you're getting someone that can say, you know what, you're 55, you're having chest pain. You probably need to take yourself into the ER. You have that, because some people will ignore symptoms. So you have that safety net to be able to talk to someone and say you need to go. So I really do think that telemedicine is going to be, it's not going to be, telemedicine is the wave of the future. And we've started to kind of see that wave going up. Of course, we got a big jump. We went like this. Now we're kind of leveling off, but it's going to definitely be what we'll be using from here on out.
And since we are in the age of COVID, could you speak to that and how your service has been able to assist those with that issue?
Yeah, especially before we were encouraging people to go get tested, it was easy for people to call in and tell their symptoms, because what we were doing, we were just quarantining. So our doctors were able to say, okay, just stay at home for this many amount of days, you've been exposed or you have symptoms, without having the person to actually have to leave. But then you had the people who would call in, but they were having symptoms that were concerning. I mean, I actually got a phone call. I'm not one of the physicians in the service, but I got a phone call from a personal friend whose mother and father both were having symptoms. And I said, both of them need to go to the ER and both of them need to go by ambulance. And so both of them were admitted to the ICU. So we can do that. That's what our training is for. And so being able to have people call in with their symptoms, because there really isn't any treatment for COVID if you have just a mild to moderate case. You just kind of take your ibuprofen and your Tylenol and, drink a lot of fluids and that kind of thing. But it's when it moves past that point so that our doctors were able to tell people, this is concerning. I need you to go in, or these are the symptoms to look for.
Right.
And you should go in. That's the most important thing, because sometimes you can call in and be fine, not have a whole bunch of symptoms. But if you don't know what to look for, then you don't know when you're supposed to go back. So I always tell people, telling people to come back.
So what are some of the symptoms we should be looking for when it gets to the serious? Well, as a matter of fact, all they have to do is go to myURGENCYMD.com.
Yeah, we have a link. Yeah, we have a link to the CDC there that tells all of the up-to-date findings and what to look for, or they can go to myURGENCYMD.com and talk to a doctor for as long as they need to and get all the answers.
And I also see that we do have your personal website, drdorsha.com. So what can we find on there?
So I have a blog that we kind of tackle different subjects. Some of them are more upbeat and lighthearted. I have one coming out soon, and you'll understand this if you go to a Black church. But it's going to be church emergencies. Okay. So those things that can happen when you're in church, and we've all seen the mother pass out, hit her head. We've all seen some kitchen stuff going on. So it's going to be different emergencies that you can see in church and what you need to do for those emergencies. So we kind of do kind of some upbeat, kind of some educational. I'm having an animated series coming up soon that'll teach people different topics and kind of break it down for people to understand. And it'll be featuring myself. I'm working with someone who is waiting on me to start it. But that should be fun.
That's amazing. I'm also beyond radio into the whole movie writing. So when I hear animations, things of that nature, that's like, oh, I love it. Congratulations to you. You're doing big things. I want to celebrate you, as I say, Dr. Dorsha James MD. She is the founder of myURGENCYMD and Black History Now. Thank you for making history. Thank you for being a part of Tennessee. Thank you for having your Memphis roots. It just speaks well to all those things. But shout out to Pontiac too. Got to shout out Pontiac.
Right.
I lived years ago in the Detroit area, so I had a couple of those highway trips to Pontiac. So
okay.
Well, any last words you want to say before we go?
Yeah, sure. I just, I would like to ask people to really take their healthcare seriously. Even if you don't have insurance, you shouldn't feel like you can't get healthcare at a reasonable, affordable price. To check out myURGENCYMD. I mean, we're offering behavioral health care, telehealth care, and patient advocacy. And we'd love to have people join.
Well, thank you very much. Be sure to check her out, drdorsha.com, also myURGENCYMD.com. And it's also on social media, Facebook, Twitter, Instagram. She's all over the place. And she's coming out with an animation and a blog. Oh, yeah. I got to get in with Dr. Dorsha. All right. Thank you all for checking out the Christie Taylor Show. We look forward to seeing you next week.